Hey, life is full of stresses, and the last thing you want to stress over is your health insurance. As you're getting ready to retire and go on Medicare, you want to be consumed with things that are important to you, your grandchildren. Maybe you're going to pick up a new hobby or just be involved in community work and volunteer work, and that's really what you want to focus on. Yet we know that this health insurance decision that we have to make is a very, very important one. And your goal should be to simplify your life in retirement. And so I'm going to show you how you can actually be on a plan that it really is the most simple plan to be on, and it truly is stress-free. You know, you really do not know how good your insurance is until you need it. I have 7 children, and one of my sons, he's actually the 3rd son, was in a very, very serious car accident. Really could have taken his life very easily, but miraculously, he survived that wreck. Unfortunately, someone else in the wreck had passed away, and a very, very sad situation. And I saw how good insurance takes care of a situation like that. If I had bad insurance, it would not have gone so well, but we had wonderful insurance. And so very, very sad situation, but I really saw how important it was to have good insurance. And so when you go on Medicare, I want to remind you that you really only have 2 choices for using your Medicare benefits. One of those is to stay in original Medicare A and B, and then you add a Supplemental Plan G to that, or you can get an Advantage plan. And so when you go on Medicare, you're going to decide which one of these systems is going to be best for you. And I'm going to show you how I think Plan G provides for you really stress-free coverage. And the reason for that is because when you need your insurance, what's going to happen? First off, you're going to have to decide upon doctors. And you realize that if you get an Advantage plan, all Advantage plans are going to have networks, either HMOs or PPOs. But when you have a Plan G and you're in original Medicare A and B, there are no networks whatsoever. You can actually go to any provider that takes Medicare. And secondly, what's going to happen is with some healthcare services, there will be what is called a pre-authorization. And what this means is this is a healthcare service that's expensive. Could be a CAT scan or an MRI, could be a skilled nursing stay, could be even an inpatient hospital stay, could be any kind of an outpatient surgery or even an inpatient surgery. But on Advantage plans, about 70% of the services that you're going to need are going to have to be pre-approved by the insurance company. So the doctor says you need it, but the insurance company actually has the final say-so whether you're going to get that service or not. If you have a Supplemental Plan G, there are no pre-authorizations. If your doctor says you need it, Medicare says they'll cover it, end of story, it goes on the schedule and you get that healthcare service. Thirdly, when it comes to healthcare and costs, you're going to have co-pays, you're going to have co-insurance, right? And you're going to have what's called the max out-of-pocket. And you realize if you take an Advantage plan, you pay co-pays for the majority of your services, co-insurance for some services, up to the max out-of-pocket, which is in the range of somewhere between about $5,000 to $10,000 every year. When it comes to a Plan G, other than a small B deductible, this year, $233, you don't have any co-pays, no co-insurance, and there is no max out-of-pocket that has to be established by the plan because that supplemental plan is going to cover all the expenses but the B deductible. And then fourthly, when it comes to using your insurance, you're going to see that some plans require some maintenance. In other words, you got to renew and review the plans on an annual basis. Certainly Advantage plans, every year they come up for renewal. If you don't like the plan, you can switch those plans, but we have to pay attention to that. If I move from one area to another, I live in Denver, Colorado, and I want to move to Dallas, Texas, I'm going to have to get a new plan because I don't take those plans with me. When it comes to supplemental plans, those plans are written for life. There's no maintenance. You pay your premium and you're truly simply done. Okay? And so that's the difference. And so the whole point is this. If you want a stress-free, simple healthcare coverage when you go on Medicare, if you take that Supplemental Plan G, we have no networks to deal with. We can go to any doctor that takes Medicare. There's no pre-authorizations required whatsoever. Medicare and you make all the decisions, and your doctor. No co-pays, no co-insurance. We just have a small B deductible once a year, and those plans are written for life, totally portable. If I move from one area to another, I get to take the plan with me. So on that Plan G, I don't think it could be any simpler because all we have to do is we pay our monthly premium, which are very, very reasonable, and then once a year, we've got to meet our B deductible. This year, that's $233. And beyond that, there's no out-of-pocket expenses, no pre-authorizations. We go to any doctor that's going to take Medicare, and they're lifetime policies. Talk about simple. I believe that's very simple.